when I was 15 years old, and I can remember as a sophomore at Robert A. Leader in biology class, and we were dissecting out pig hearts. And right then, I developed a fascination with hearts in general, and then human hearts. And it was about that time that all of these tremendous strides in heart surgery was taking place with Dr. Cooley and Dr. DeBakey and aforementioned Dr. Barnard. And it was a very exciting time, and I started reading about that. And I knew that in some form or fashion I was going to specialize in taking care of diseases of the human heart. Probably Dr. DeBakey, Michael DeBakey in Houston, Texas. I first met him as a junior medical student. He was head of the Baylor College of Medicine in Houston as on a surgical clerkship or rotation. And in those days, the students would scrub in on the cases with the faculty, and we would hold retractors to facilitate exposure for his operations. And I was immediately impressed with his meticulous attention to detail, if you will. And he had a steel-eyed concentration on the task at hand, and nothing would cause him to deviate from that very specific task he was doing at the moment. And I was so impressed with that I decided right there that I was going to be a heart surgeon, and then spent the next 13 years at the Baylor College of Medicine affiliated hospitals learning to do just that. I saw a lot of opportunity here. I know what it's like to be in East Texas, to work with East Texans, and I know the quality of people that we have here. And to me, it was a gorgeous gift to be able to come back here and take care of the East Texas community. They do have a philosophy, or a goal, if you will, to make this a world-class cardiovascular center to manage this disease. My philosophies are very much akin to this institution in all of those areas, and that's why I wanted to become a member of this team. We're very excited about the opportunities that we have to make this not only one of the best programs in the region, but in the country. And that's our goal, and that's what we're going to give our best to accomplish. So many things evolve, particularly in the field of cardiac surgery. They're so much different today than they were even 10 to 15 years ago. The advent of off-pump surgery, for instance, not using the heart-lung machine, robotics. 6 or 7 years ago, nobody would have even dreamed that we would be doing heart surgery with the robot. And now, 6 years later, it's, well, when can we start to do this? I mean, there's a rush now to try to learn these techniques. So what was considered to be pioneering efforts 6 or 7 years ago is mainstream now. You want to take care of them like you would want yourself to be taken care of, or you would want your mom or dad to be taken care of. And if you do that, you're going to give that patient your very best.